Southwest Health System is a very interesting, progressive, community-based healthcare system. We employ a large number of physicians and providers in this community, and we also have a pretty complete medical staff for a community of our size.
We're the only Medicaid provider in Montezuma County besides the federally qualified health center 35 miles away. And we're the only ones that will take Medicare patients that don't have secondary insurances. So really we're serving our target audience is the market that's underserved in the area.
The patients themselves tend to be extremely hardworking folks who don't complain a lot and don't like to go to the doctor unless their leg is falling off and then they show up on your doorstep. So, you know, things tend to be higher acuity level, things, you know, people have tried to manage kind of on their own until the point that it really does become, you know, pretty severe.
Hi, my name is Joanna Dominic. I'm a family nurse practitioner, and welcome to Southwest School-Based Health Center. Come on in.
We are part of the building, so this school is, the school building itself is going into its third year, and when this building was built, the clinic was designed into it. And so right outside of the clinic is a hallway that's got classrooms in it, and so kids are walking past between classes.
The school-based health center is a really, it's really small, and they kind of have a good system. I love that you can show up and just pull a kid out of, or have a kid called down. You have a pretty captive audience, which is a unique thing for mental health.
We do those acute visits plus preventative care. But the positive benefit of school-based health is that you can get all of that under one roof. The parents sign a consent at the beginning of the school year, so the students can be seen and they can come in at any time.
We know that we're able to provide better primary care services to students who might not have that good access once they go home from school. As we integrate it with our physician practice model, it gives us an opportunity to blend that as part of what we do in providing services across this community. And for us, it just becomes another location that we're able to deliver care.
Growing up it's tough these days, you know, with social media, you know, all the pressures from social media that kids have to deal with day in and day out, the bullying.
We have every bit as dire of needs as the main population centers do, and we just don't have as much support.
We have a lot of unresolved mental health challenges, and trauma, I think, plays a huge role in that. We have a lot of intergenerational trauma, trauma that hasn't been addressed at all. A lot of people have never told anybody things that have happened to them 20 years ago. As a result, we have all these different health issues that are probably exacerbated because of that trauma.
If a child needs psychiatric support, you know, something more in depth than what our provider can feels comfortable doing. You know, in Denver, there's a lot more options. Here, we have one option, and they're typically booked 2 to 3 months out. Our closest inpatient unit for someone who's under 18 is in Grand Junction, and they're typically full. Past that, we have to look to the Front Range, and so we're dealing with a 6 or 7 hour drive.
We need mental health facilities here, and not so we don't have to transport to Durango, or the bed space that isn't available when we need it. Our suicide rates have increased. We've had more even this year than last already, and this has got to stop somewhere because it's affecting whole families as well as the community, and it is a community problem, but it's a societal problem.
And with having seen several suicides recently, there's certainly been excuse me, a bump in awareness around it. You know, a lot more kids coming in and talking about it and kind of saying, what does this mean? What is the reasoning behind this? As far as I know, since the end of the school year, we haven't had any, any more adolescent suicides. And so it'll be a lot of trying to get through the first part of the school year and be there for the kids and hope that we can kind of put an end to it.
We've saved a lot of kids by what I've done to change. It's brought it to the community. But it's happening everywhere. And it's heartbreaking to see what happens to families. And the mental health, it is a problem that it's not going to go away. It is actually increasing. For whatever, there's so many different causes of it. You can't put your finger on any one or two things. And so you just have to learn how to deal with that and have those facilities and the proper professionals to be able to help. That's where we're trying to come up. We just want something here. We need it, and we need it now.
Mental health stigma is a challenge here, and I think a large part of that is just because people know your car, they know you, they know your mom, they know your cousin, and so separating things out, and that becomes a challenge for providers as well. I mean, it's, you end up knowing some way, somehow, a lot of people that you work with, and I think in larger areas you can just say, well, I can't because I have this connection, and there's just not another option here. So we do the best that we can.
They are willing to get care for behavioral health. I think that some resistance happens though when I have patients that establish care with some sort of behavioral health therapist, whether it's a social worker or a psychologist or whatnot. But if that therapist doesn't stick around in Cortez and leaves after a year, that patient feels like I just wasted a year opening myself up to this person and trying to build trust, and now this person's left and you want me to go see somebody else.
There's definitely been a shift in what the kids perceive, and we're seeing kids that maybe the first year I wouldn't have even thought would come in are now coming in, and they're pretty wide open about it. This last year especially, we would have kids bring their friends in and say, hey, I come talk to Mike once a week, like, you should do this too, it helps. And so, yeah, there's definitely been a change just in so far the 2 years that we've been open, and I expect to see the changes hopefully keep coming. In a rural community like this, we have a lot of ranchers and farmers that have been around here for generations and have the kind of pull yourself up by the bootstraps attitude, and if something's going wrong, just go out and just deal with it. And so changing that mentality and saying it's okay to want to talk to someone. It doesn't have to turn into this all-consuming problem. You can talk to someone for a little bit and then get back to life.
A lot of health problems are affected by behavioral health, and so it's really great to have a service that provides the other component other than medicine. So
we have a social worker in the clinic. I'll probably bring a second social worker on. Part of what she does is care management. Part of what she does is just low-level goal setting with patients. But it takes that off the doctor. So hopefully the goal there is that when the doctor says we need to do this, this, and this, and the person goes, I can't do it, I don't know how to do it, then our social worker can help facilitate that, and the physician can see somebody else, at the same time.
And social workers are important in healthcare because we find that oftentimes clinical issues and clinical needs are only a part of a person's life balance needs. Their social needs oftentimes are more important, more critical, and more determinants for improved health than sometimes even the medical care. So if we only address the medical needs of somebody, we'd discharge them back home, and they'd probably trampoline right back to us because those other psychosocial factors as a part of their overall well-being are not being addressed.
My caseload and all of those different things has grown exponentially since I started, and so I just see a lot of potential for continued growth, and I get pretty excited about where this is going to go.